Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
Hello again, everyone. We are here today with the wonderful Loren West, who is an occupational therapist and clinical operations manager, as well as a PhD candidate at the Healthy Strides Foundation. Hi, Loren.
Hi, thanks for having me.
Thanks for coming on. We are here to talk about your paper, Health Equity, Knowledge Translation of Evidence-Based Interventions to Improve Functional Mobility in a Low to Middle Income Country.
It's a pretty cool title, I would say.
It is a very cool title, and I'm really excited to learn a little bit more about this paper.
Sure. Cool
I
work.
can talk about it.
Well, given that kind of title of a paper, tell us, where did this come from? Like, what inspired you to even do this work?
Yeah, I mean, it's a great question. I think just being inspired on a day-to-day basis in what we do here in Perth in Western Australia. I absolutely love what we do here and fully believe and invested in it. And then having travelled to Malaysia numerous times and having met people over in Malaysia and worked with children, we just knew it had to happen. And it's just such an important thing to provide these services in somewhere like Malaysia.
Yeah. And what do we know, I suppose, about the functional outcomes for children in these low to middle income countries compared to countries like Australia?
Yeah, well, I mean, there's lots of barriers for children in these countries, in particular limited access to healthcare services, both in like quality and expertise and knowledge. And then there's the cultural perceptions of disability as well. It's something we're working really hard to change. And then things like, socioeconomic risk factors and delays in diagnosis. We know that their average age of diagnosis anecdotally is around 4 years of age, but likely it's probably much more like older than that. And of course, in terms of functional mobility, there's very limited resources in terms of equipment and supportive equipment. So they just don't have the movement opportunities.
Yeah. And I think that the title saying even health equity, it brings up so many things already right there.
Yeah.
And it almost feels like sometimes functional mobility, it seems like it should be this, the cherry on top. It's just this extra thing that you get when we're talking about health equity. But why would functional mobility be so important given all the other, barriers that might happen?
Yeah, and that's something we're working really hard to educate on as well. It's not just getting them in a piece of equipment so that they can move around. It's getting them upright and active and moving and participating and just experiencing the world from a different view as well, which I think is hugely important.
Yeah.
There's been such a shift. I feel like, I don't know, in the last conference that we went to at EACD, we talk about the ICF a lot, right? Yeah. And there was this shift, and I love how Professor Bernard Dan sort of said it. He's like, we have these models and they're great, 2001, we've got the right language, but now let's look at different kind of models and look at it from a human rights perspective. And then suddenly everything changes once again when you look at it from a human rights perspective. How do you sort of contextualize your work within that? Yeah,
I think it's really about changing perspectives. There was a recent UNICEF report that indicated that in Malaysia, 58% feel that they're underinformed about disability. So that's somewhere where we can intervene and make a really strong presence. 1 in 3 believe that children with disabilities should be kept hidden, which is quite confronting. And that's something that we're ready to challenge. And also around 43% believe that children with disabilities are going to be disruptive in the classroom. So they don't even have the education opportunities that they should have. So we're just here to create any kind of change that we can and positive and help to change those perspectives.
So with all that in mind then, Loren, tell us about this study and the work that you did. What was the question that you were trying to answer?
I guess we were just trying to see if it was feasible to implement locomotor training, which is something we're really passionate about here at Healthy Strides, in Malaysia, in a low to middle income country, and see what outcomes we could get in terms of goal attainment and functional mobility.
That's really cool.
Yeah, very cool.
So how did you go about doing that? I think that's the big question.
Yes,
because when
absolutely.
you say locomotor training, very familiar with it. It requires expertise and equipment.
Yeah.
Yes. Yeah. And all of that is currently in place in Miri, Malaysia at the moment. So the participants underwent a 6-week program of locomotor training 3 times a week for an hour, so getting a total of about 18 hours of therapy. And they did partial bodyweight support treadmill training and then had opportunities for active stepping throughout. And then it's always followed by an overground component. So depending on what their goals are, whether that's with the use of supported stepping devices or without.
Yeah. And just coming back to the training component, because I'm thinking, if we're talking about knowledge translation and making sure that what you're implementing over there is something that's sustainable, how do you overcome some of the language barriers? Like, I'm assuming that English is a second or maybe even third language for the people that you're training over there.
Yes.
Perhaps you don't speak the language.
Yep.
How do you overcome those kinds of things?
Yeah, that's a great question. And I think we have an amazing team over there. They've got a very diverse language background. So in terms of communicating with families, certain people can speak certain dialects and things like that. And it's just about a team, really, and those really important collaborations and partnerships with us here in Perth, the local partnerships over in Miri, and just that continuing training and education.
Yeah. I mean, that sounds a whole lot like another buzzword in research is co-design, right? I feel like I see co-design everywhere.
Yeah.
But realistically, that's what's needed to get these things off the ground. You can't impose our impression of how things are done in Australia into another country because instead of all the different aspects and the barriers there. But if you have local people, local partnerships, at least you're another step closer, aren't you?
Yeah, and it creates that local understanding as well, which is really important. We need to understand things from their perspective and their wants and needs.
Yeah.
But it was just really cool to see that even parents, really valued the interventions, which it was something so new and different for them. But they saw the results and they really valued it. So I think that's huge.
Yeah.
Okay, you've touched on a buzzword there, results.
That's right. Yes.
Tell us what you found.
Yeah, so we used a variety of outcome measures. So in terms of goal attainment, we used the Canadian Occupational Performance Measure, of which, as I just previously alluded to, there was clinically significant change there, which is really exciting and I think really important.
Absolutely.
We also used goal attainment scaling, and it was really exciting to see that around 77% of children achieve expected outcomes on their goals.
Wow.
And this was also reflected statistically in their T-scores.
Yep.
And then in terms of functional mobility, we used the 10-metre walk test and the 6-minute walk test. And the 10-metre improved on average by about 20 seconds, or reduced time in walking speed, which is really cool. And walking endurance is reflected by the 6-minute improved as well.
Gosh. I mean, that's really cool. And it almost reflects a whole lot of the results that we'd see in our clinical practice.
Absolutely.
Right.
Yep. Yeah.
What do you think that means?
It means that we can do it, we can do it if we have the infrastructure in place, we have the partnerships in place, that it is truly, it can be done.
Yeah.
And it just fully reflects that, mobility is a human right no matter where you live. We just need to get the word out there and the training and the expertise out there, and it can be done.
Yeah. And I think, back to your point earlier, Dana, and what Professor Bernard Dan was talking about, the ICF and frameworks like this are amazing and really important guides for us to develop and implement interventions. But sometimes we get stuck in the framework. And, for when we're talking about health equity, I feel like sometimes it's just a matter of, safely and with the right training and resources, but we've just got to do it.
We do.
Absolutely.
Yeah, I think so. And look, how many times have we spoken on this podcast now in the, 160, 70 episodes, we talk about mobility and movement and the importance of exercise. And, I know I've seen before in children in Malaysia, they would often just be lying on the ground because they don't have any equipment.
Yeah.
So they don't have wheelchairs. You can see their body posture change as a result of gravity. I guess within that context, Loren, where do you see? Because I think there's a lot of space to go still and improvements in getting more mobility equipment out. We've started seeing it happen in Australia. So we're really seeing it start to happen.
Yep.
What does this mean for this long term for these guys?
I think it just means that we just need to expose children out there in the community in supportive equipment. I think that's a huge cultural shift, which is going to take time, but it's one step at a time. And then the more exposure that you get, perhaps the more equipment we can get. And then just putting the word out there that these kids need to be up, because it's not only just about mobility. It has huge flow-on effects in terms of like well-being and cognition and social engagement and just the opportunity to be part of their own world.
Yeah. So I suppose that advocacy and awareness piece in the first instance is
huge.
Crucial.
Yeah.
Funny question. Let's put it out there. I mean, you are an occupational therapist talking a whole lot about mobility here. I thought this was my domain.
Flag in the ground.
That's right. The age-old tale of these rivalries. But I love the Back in the day, you used to split the body in half, right? Like you look after this, you look after that. Talk to me about that, because it's pretty cool that as an OT, your perspective in going into the space and looking at this is going to give another perspective altogether. But what's that like for you?
Yeah, I mean, I think it's incredible to have the opportunity to wear so many hats and to not just look at things in isolation. I think that's the key point. OT is all about participation and engagement, and this is what facilitates that.
And when you think about that kind of context as well, it's almost, I don't know, it almost can seem like a luxury, particularly when you're in Australia. You can have a speechy and an OT and a physio, and you can have all these different disciplines. But when you're talking about the different barriers, you talked about expertise in places like Malaysia. I imagine it'd be very, very rare to have all those disciplines at your disposal. So that whole interdisciplinary model, almost that key worker model that gets spoken about a lot, becomes really important.
Yeah, I think you just get a better view of the whole picture, not just one thing in isolation. And it enables you to, really give them the best experience. Not just about walking, but play whilst walking and things like that. It's really exciting. It's really rewarding.
Yeah. When you bring it back to the rights of the child as well, then, you know, everyone has a role to play in.
It's so true, isn't it? Yeah.
Ensuring that their needs and their rights are met.
Yeah. I guess it comes back to the themes of the conference, respect and reimagined, and how do we respond? I think there's so much there that seems to align beautifully. So no wonder this got accepted as part of the conference.
Yeah.
I guess a question that people often have now that you've got these kind of results is, what does this mean for future work in the area? Because we did notice the PhD candidate that was popped in there. So what does this mean in terms of future work? I'm gathering this is the area you're going to be working in.
Yeah, I mean, it just means that we want to intervene earlier, really. Like, as we mentioned before, the delays in diagnosis it's huge, and it has a huge implication. If we can establish a early diagnostic pathway and early intervention pathway, then we can get things happening sooner and in that crucial window. So that's really where I want to focus. Because then that has a massive flow-on effect to later in life. And starting things early, talking about equipment early, talking about education and training for both parents and healthcare workers over in Malaysia. So that's where we'd like to head.
Yeah, and bringing us closer to true health equity.
Yes.
Yeah.
I love that. That's really cool.
Me too. And I'm so excited to see, the rest of the work that comes out of your PhD, Loren.
I'm excited.
I'm sure it will keep you very busy.
It will. Yes.
Well, thank you very much for coming on. I hope everyone really enjoyed that episode. I know we did. And there's so many more of these episodes to come as well. So we'll talk to you all again really soon.
Bye.
Take care. Bye.